The chair recognizes my colleague from the great state of California, Jackie Speier, one of the co-chairs of the Women's Caucus. And I congratulate you on your work on this bill and others. Thank you.
Thank you, Madam Chair, and double congratulations to you. I look forward to serving under your distinguished leadership as chair of this committee, and also for the success in getting paid family leave for federal employees, which should jump the numbers up a little bit. I must say I'm a little astonished by this debate today, because the Republican Party prides itself in being the party of the family. And when we have 81% of the families in this country not eligible for paid family leave, I would think you would be running to support this bill. But it appears that it's not really about the family, it's really about making sure that big business has the lowest tax rates possible. So let me talk about California, since it's been the whipping child here for the last few hours. California passed the paid family leave in 2004. 99% of employers report that the state's program has had positive or neutral effects on employee morale, and 87% that the state's program has not resulted in any increased costs. Not only have wage costs not increased, but turnover rates have decreased. In California, implementing paid family leave was even linked to an 11% decrease in elderly nursing home use. And as it was pointed out of my distinguished colleague from Michigan, the study that's been referred to by Ms. Gressler was a very narrow study. It looked at only the first year of operation of this law back in 2004. It was only for moms having their first children, and it was before the law in California was enhanced to provide higher wage replacement. The study also explained that many of these mothers may not have returned to full-time employment out of choice. Amazing that we have free choice to be able to make decisions whether we want to stay home with our children or not in some cases. It also showed that women may have worked fewer hours or wanted more flexibility or become self-employed. So that's the California experiment that has actually worked extremely well. There is an effort now in our state by our governor who wants to extend it to 6 months of paid family leave. We know in Europe it's 1 year of paid family leave, and if you're in Germany, my goodness, you can go and have a week at a spa to deal with postpartum blues if necessary. So we are so far behind the 8 ball that it's embarrassing. And to have this discussion about imposing some burden on business when the Family Act is only going to cost about $2 per week for the typical worker says it all. So to you, Ms. Szabo, can you elaborate on the impact that California's paid leave program has had?
Yeah, California's program has, by several studies, increased workforce participation and earnings. It has reduced child head trauma. It's had a reduction in Medicaid nursing home use, as you said. It's been tremendously positive, and we've learned a lot about what it takes to implement a program effectively and make sure that the people who most need to be able to use the program are able to use it. And those efforts are ongoing. So medical legal partnerships are being developed by groups like Legal Aid at Work. The state is trying to do a better job of outreach and engagement to people in other parts of the state besides the sort of big cities. There's a lot of work that needs to be done. I think, and on the cost element, California's contribution is 1%. There's never been backlash on that. There's always been a surplus in that fund. And what we see in national polling data about willingness to pay is that workers are willing to pay far more than that 1%, and certainly far more than the 0.4% that the Family Act would require. And even the cost estimates that are at the outer bounds of a good cost estimate around what usage would look like show that the costs will not be prohibitive and that people are willing to pay those costs. And some of the cost estimates that are out there, like one of the ones Ms. Gretzler mentioned, are based on completely out of bounds estimates around leave taking. So for example, the American Action Forum study that they referenced suggests that there would be 16 million parental leaves a year. We only have 3.8 million babies born in this country every year. So we can't rely on those cost estimates. There are good estimates from the Institute for Women's Policy Research and the University of Massachusetts that are much more accurate. There's even a cost calculator on the American Enterprise Institute site that was developed by a team of researchers that shows that costs in no way, even taking the most generous estimates, will be more than 1% and more like the 0.4% that's currently in the bill.
I thank you, and I yield back.